Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Let us try to understand what a frozen embryo transfer is. This is very different from a fresh embryo transfer. What are we talking about and what are these embryo transfers? Basically, they are a part of a treatment called IVF. And what's IVF? IVF is a procedure which encompasses bringing the eggs out of a woman's body, mixing them with their partners or husband's sperms, making embryos, and then transferring these embryos back into the uterus of the woman. This transfer of embryos back into the uterus can be of two types: fresh embryo transfer and frozen embryo transfer. Let's try to understand a frozen embryo transfer and see what kind of medications and blood tests are done during this procedure. A frozen embryo transfer involves presenting yourself in front of a doctor on day 2 or day 3 of your period. Once you go there, your blood tests are done, your a scan is performed, and then we try to assess how your endometrium and ovaries are behaving, if there are any cysts, if bleeding was not complete and the endometrium is still thick. All these things are assessed, and to confirm this, blood tests are also performed, such as estrogen and progesterone. Now the idea is that estrogen and progesterone both should be low at this time of the period. Once this is done, estrogen is given in the form of oral tablets or vaginal tablets, patches, etc. Mostly oral tablets are given. These oral tablets could be from anywhere from 9 to 12 days or 13 days, depending on the kind of response that your endometrium is giving. After estrogen is given, progesterone is also introduced. This is a very important hormone which transforms the endometrial lining. So estrogen tablets are given to grow the endometrial lining, that is the lining of the uterus, and progesterone is given to transform it. This transformation is very important for an embryo to implant in the endometrium. So when estrogen is given, after about certain number of days, like I said, 9 to 13 days, depending on the kind of response you are giving, your doctor will also do a blood test. This blood test again tests your estrogen and progesterone values, and depending on the values, progesterone hormones are also introduced. These hormones again can be injectables or vaginal tablets, and once these are introduced, about 4 days to 6 days later, an embryo transfer is done, depending on the stage of the embryo. If it is a day 5 embryo, then on the 6th day of your progesterone tablet, the embryo is transferred back into your endometrium. This is a very crucial step. No matter what the number of estrogen, the number of progesterones are fixed based on the stage of your embryo. So this is very critical. The idea is basically that your estrogen should be rising once the estrogen tablets are given, and progesterone should be maintained as low. And when this is happening, progesterone hormones are introduced externally and an embryo transfer is performed. Frozen embryo transfers are usually being performed today because the idea is that when your eggs are being grown by giving external hormones, gonadotropins these are called as, the endometrium may be mismatched to the embryo, may not be receptive, which is why now most clinics are moving towards frozen embryo transfer. If you want to understand more about IVF or frozen embryo transfers or your success rate depending on your age and other factors, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.